Purpose of us being here today is to demonstrate a quality conversation between a supervisor, who I will be, and a worker who is presenting a case that will not be identified. We are going to try to demonstrate how the use of open-ended, solution-focused questions can contribute to the development of critical thinking skills in FSWs, and then can bleed through, so to speak, to the family. What we have found over the years is that critical thinking in any institution starts at the very top, starts with the leadership, and goes all the way down to the employee, the worker, whoever that is. It's different in child welfare because our work product are actually seeing that families are able to make changes in their lives. So what we also want to do in the development of critical thinking skills is to have the worker be able to learn from their supervisor how to go out and talk to a family and to ask questions like, what do you think, to that family, so that they can feel empowered to be a part of their own assessment and planning process. Critical thinking is quite simple, and it's to describe. It's very difficult to get to. Critical thinking is basically using the facts, the history, all of the information at hand, and putting that together in a logical sequence and trying to make some decisions associated with that. Supervisors and workers do sort of a joint critical thinking piece, and I think that that's what we're hoping that we'll be able to demonstrate today. The demonstration will probably last between 25 and 30 minutes, and at the end of the demonstration you will be able to critique what we did and to look at whether we covered the areas that are important for us to cover. Good morning, Maria. How are you?
Good morning. I'm fine. How are you?
Good. Good. We are here to talk about the family that we had discussed before.
Yes.
And I just wanted to start off with you maybe giving me just a brief overview of what's going on with the family right now.
Okay. Well, we received the referral in Child Protective Services a couple of weeks ago, and the family was in Walmart, and the child was acting unruly and irate. She was fighting and biting her parents, and therefore the security thought it was, of course, not normal behavior. So they talked to the parents, and the parents said basically that the child was autistic, and that this is how the child acts when they go out into public, and that they would like some help, to address their child's behavior. So that's how we got involved. We met with the family, and the family basically reiterated that same story, that their 10-year-old child, has autism, and they have been trying to get assistance in the community through their doctor, but unfortunately the service that they had no longer working with them.
Okay. Are you you're working with family now, obviously?
Yes.
But can you tell me a little bit about the way you view your relationship with this family at this point in time?
Well, initially in meeting with the family, of course, the mother and the father, they have kind of a different relationship. They are divorced, but they live in the same home. The father allowed mother to move back in the home to help with the child. So the mother initially was upset because they have had history with DCS in the past, so she didn't understand what the purpose was and kind of didn't want us in the home. But I sat down with her, explained that we were there to help them get services for their daughter to address the autism and the behaviors they were having with her. And the father was, he was very open, said that he wanted help, had been trying to get assistance, and the last service provider that they had closed the case, and therefore they didn't have any services. So he was grateful that we were in the home. So it started off kind of shaky with mom and on a good note with the father.
Okay. At this point in time, what do you think needs to happen? What do we need to help them with? What needs to happen in order for them to, start making some good decisions and start getting the family functioning the way they really want to function, I'm sure.
Right. I think definitely we are looking into getting services to address the child's autism, of course, and some of the behaviors, because she bites when she gets upset, or she'll throw things or have tantrums. And of course, because she's not verbal, it's really exaggerated. So definitely get an in-home provider that can work with the child and how to address her behaviors when she wants something. And then also the parents, how to help them respond to the child without, disciplining her or, doing something that's excessive, but also teaching her that it is, there is a certain way to get what you want, so they can work with her, work with the child on speech, and then work with, like I said, the parents on a different way to respond. Okay. So definitely in-home would be the very first step, getting some in-home services.
Any barriers to getting that type of service? I mean, are you thinking about a particular agency to provide that?
Well, I have thought about an agency. Unfortunately, the agency that first came to mind has worked with the family in the past, and because they feel like the child's behaviors are too extreme, they won't work with her. So I am going to try another agency in the community that deals with autism. So I plan to make a referral to them to see if they'll be able to work with her.
Have you talked to someone at the agency that initially worked with the family?
Yes.
What was their view of the family? I mean, did they feel like that they were successful, or?
The agency's view, initially she had a worker, and the worker and the child got along well and everything was going well, and so they had that worker for about a year, and that worker left the department. When they reassigned the case to the new worker and the child didn't get along, didn't mesh well, and so the new worker and the parents as well, they didn't get along with the parents. So the new work in the agency therefore felt like, because their behaviors were so extreme that they weren't getting along, and they felt like the parents kind of were not as, like sometimes they would miss appointments, or they would have an appointment and miss it, and they wouldn't reset the appointment. So they felt like the parents weren't putting enough effort into it to help with their own situation. So. Okay.
But there was a difference between the first worker and the second worker.
Yes.
Okay. At this point in time, since you're looking to put another agency in to work with both child and parents, what do you think we need to know about this family that will help us and help the agency that's going to be working with them be successful this go around?
Well, the first thing I would do is meet with the family and talk to them about what they feel like worked the first time with the initial worker from the agency. So to find out if it's, does the child respond better to female workers, or does, just what behaviors or what caused them to work well with the first client. So I would ask the family that, so we could possibly, when we set up with the new agency, ask for that type of work, or just let them know this is what the family feels works for them. So can we accommodate that so that it'll work and be a better fit?
Okay. So what I think I'm hearing you say is you're going to rely on them to kind of tailor their own intervention here then.
Right.
Okay. All
Correct.
right. Well, I think that's excellent, because I mean we've already had an example of, you know, one agency that actually worked well with them, but then changed, you know, the kind of the format of the treatment in midstream, and then they didn't work so well. So I think that's a good way to look at that. Tell me a little bit about the family's support system. I mean, and the reason I'm asking you that in particular in this case is because a family with a child who has that level of special need really does need, you know, some of those informal supports out there.
Right. And unfortunately, the family doesn't have a lot of informal support. They do have, the father is from the Middle East, so he has a brother that lives here. So his brother and his sister-in-law, they do help out. They will babysit, you know, if needed, or do things for them if needed. The biggest thing is that her behavior changed, I think right along the time probably that they stopped getting the services. So again, she's a little more extreme, and so the sister-in-law who was babysitting has children of her own, and kind of is leery about allowing her to be in the home around the other children, because she can be a little physically aggressive.
Okay.
So but they do have that support when needed. And then the mother's family is, her parents are deceased, and she doesn't have siblings, so she doesn't have any family here in the area.
Okay.
So they don't really have, the father does have a friend at work. If he needs to leave work and go home to check on the child, then he can do that, because he's you know, friends with where he works.
Okay. And these people, will they be continue to be involved with you also? I mean, have you talked to any of these folks, or are you looking to maybe incorporate them into the team? Or?
Yes, definitely. I have talked to the aunt and uncle, and they are willing to be a part of the team, and said that they will continue to try to help as much as possible without putting their own children, you know, at risk. Yeah. I have not talked to the friend of the father's at work, but will definitely put a you know, note to do that so they can become a part of the team, because we definitely need, I think informal supports are going to be a big factor in this case.
Okay. Just help me keep up with these, because we're going to do a couple of next steps on this one, and that might be one of those. You said this child is how old?
She's 10.
10. What has been her educational experience up to this point?
She is currently at a school that addresses behavior and diagnosis such as autism, so they are aware of that, and then she's in, of course, a special needs class. The father is, or has been, working with the school to get an aid for the child while she's at school, so that's in progress. And then also I've talked with the social worker at the school to see if we can get speech set up for the child also.
Okay. Have you noticed, or has anyone told you that the behaviors at school either match or don't match the behaviors that they're observing at home?
Yes, they match the behaviors they're observing at home. At school, if she doesn't, I guess, get her way or get your attention, then she'll, you know, she might hit another student. She has hit other students. She has broken things in the class. She's tried to bite the teachers. So the same behaviors that she does with her parents is the same behavior she shows at school.
Okay. You know why I ask you that question, I suppose.
Yes.
Okay. All right. That happens a lot when we see a whole different range of behaviors in school versus at home, whether it's good or bad. You know, it's something to kind of flag and watch for.
Right, that she does show. Now, one area that I have noted that is she acts a little more aggressive with her mother than her father, because her father has her on a routine and a schedule, and he does everything the same for her. So she and the father get along better than the mother, who is not so routine, and so she does have issues with her, which is the same thing that happened at the school. She got a new teacher, and so they feel like that's part of her behavior issues at the school also.
All right. As far as, we talked about your relationship with the family earlier, have you thought of ways or strategized ways that you could use what sounds like a good relationship with the family to move them along, to move them toward safe case closure? Have you thought how that's going to work?
Yes, I've definitely, like I said, have a better relationship with the father. So most of the time I talk with him about, things that need to happen and how we need to progress. And I talk with mom as well, but he's better at relaying it to her, and then she'll, accept it better. But I think just getting them to understand that we are here to help, but we don't want to enable. We want to get a service put in, help them, give them some resources so that when we're gone, they are able to look those resources up or call that person or make that contact without having to get the department back involved. So kind of just leading them to be more self-sufficient. I'll put in the referrals, I'll hook them up with people, but slowly, pull away.
Okay, all right. You've mentioned a couple of times that your, maybe not your relationship, but the pattern of communication with the family goes primarily through the father. Is that going to be a barrier, do you think, in this case? Or do you really need to work on your relationship with the mother?
I think, yes, the mother and I could work on our relationship, definitely. Just getting her to be more accepting and understanding. And part of it is that she, of course, doesn't have custody. I don't know if I mentioned that, but the father, when they divorced, the father got custody because mother had some drug issues. So I think that's a big reason why mom has a shield up a wall, because again, she's dealt with DCS before, and she doesn't she feels like, well, he has custody, I don't really have any say in this. So I think just empowering her and encouraging her to say, you're still the mother. He has allowed you to live here to help take care of her, even though he has custody. So just encouraging her may help, should help our relationship.
Okay, all right. Have you talked to either of them about how they felt when the former agency pulled away? How long ago was that? Do you remember?
That probably has been a couple of months.
Okay, so it's just been a short period of time. I just wondered if they kind of felt abandoned, at that point in time. I'm not trying to put words in your mouth, but have you talked to them about how they felt about that?
Yes, they definitely, just what you said, felt abandoned. The father feels like he's talked to the child's doctor, and so he was trying to get them to make a referral somewhere else, and unfortunately I'm not sure that they are able to understand the father as well. There is a kind of a barrier with language. If they don't understand what he's saying, then I think people just kind of let it go. So the doctor's office didn't do anything, and so he felt even more, shut down. He felt like there was no services for them to deal with autism, and so he just wants, he says it every time I meet with him, he just wants help, he just wants assistance with his child. He tries doing things on his own. Like I said, he set a routine. He'll drive her around in the afternoons just because that's what she likes to do in the car. It settles her down. So he does things that he's learned on his own to do, but he would love to get more education around what will help his child.
Okay. Based on what you said, I'm assuming that he has a lot of dealings with the school.
Yes.
Does she?
Mom, not as much, no.
Okay. All right. Okay, because that, if there are things working at the school that are not working so well at the home, you know, and he can replicate those things, you know, he can see how that works and replicate those things at the home, then that might be something that would be very useful. But if he's got a good relationship with the school, he should be able to see that. So.
Yes, he does. And they have given, I think some of the things that he does in routine and repetition is from the school, saying that she does not like change, so he tries to make everything routine at home.
Okay.
So.
Okay. The agency that you are looking at the present time, and I'm kind of going back to something that we talked about a little earlier, but the agency that you're talking about utilizing to provide services for this family, given the fact that they felt the way they did about the other agency withdrawing, how do you plan to deal with that with this agency? We don't need that to happen again, I guess, is what I'm saying. So.
And I will definitely address that, and you know, just what you said. Let them know that they have worked with the agency. The child has severe, extreme, you know, behaviors, not the normal, you know, behaviors that come with autism. Hers are very extreme. So in talking to them, I'll let them know basically if they feel like they can't work with the family based on these behaviors, to let me know before we even, you know, meet with the family, because we don't want to start something and again stop. So that's what I would meet with them to go over and let them know the background and the history of the child's behaviors, just to ensure that they are able to work with them.
Okay. All right. What to you are, if there are any, what do you think are the missing pieces at this point in this?
I think the first missing piece is mom's relationship with the child, and I think it stems from, again, she has a past history of drug abuse. She currently takes pain medication and prescription medication for anxiety. So I think that definitely plays a part. So I think we probably need to look at maybe getting mom a A&D assessment or mental health, talk to her mental health provider just to make sure that the medication she's on is appropriate, and then also that they know that she is home taking care of a 10-year-old autistic child, because she does keep her for about 2 hours after school until the dad gets home from work. So just talk to her providers to see if, like I said, they feel that on this pain medication that she takes and the anxiety prescription, is she able and, you know, capable of caring for an autistic child.
Okay. All of the people that you have talked about being involved or potentially being involved with this family seem like potential team members to me. So do you see at this point in time any barriers in putting your team together from the standpoint of, you know, getting the school, getting the provider, getting the informals involved?
No, I don't see any barriers other than the normal that everybody has time, you know. But the school is very supportive and wants to help. The family members, aunt and uncle, want to be a part of the team. So I think it'll be I think it'll be easy to get the team together. The only maybe one person that I would maybe ask to provide some background would be the doctor. And because, like I said, the doctor, it's kind of like the first agency. They feel like the parents don't follow through on things. But I think it's a language barrier that they have with the father. So it may be hard to get the doctor to provide information or come to the table. And it may not be comfortable for the parents for the doctor to come. So I may talk to the doctor by phone and present any information at the meeting.
Well, that's a good way to look at that. I'm really glad you recognize that, because a lot of times you can invite somebody thinking they won't come, and then they show up, and it's not necessarily a positive thing for the parents.
Right.
So, we've talked about a number of areas on the practice wheel. You know, I think that clearly you are working on your relationship with mom. So, and you've got a good relationship with the father at this point in time, a good working relationship with him. So it sounds like that from the standpoint of them being engaged in their own planning process, the father is at this point in time. He wants to work with this, with the agency. He wants to see his family move forward. The assessment piece, I think that you know, given the early stages of the case, I think you've done really well with that. I mean, I think we've gotten a lot of information, you know, from the past. We've got a lot of information from previous providers. We've got information from schools. So I think you're doing well with that. I think that there's with your engagement now with the family and their engagement with the process, I think that you can continue to play on that strength there to get more and more pieces of the family's puzzle, if you know what I mean. You're putting the team together, so I guess that we're still at that stage, right?
The initial stage of teaming, yes.
Right. Okay. All right. As far as planning goes, what we've talked about today sounds like I would see that in a plan. I would see everything that we've talked about today somewhere in the planning process.
Yes.
Is that right? Okay. Do you see at this point in time any barriers in either planning, you know, making the plan like we've talked about, or any barriers in implementing the plan?
As I said before, I think one barrier in planning with mom will definitely be her resistance. She probably won't be, initially she won't be open to getting a alcohol and drug assessment, but I will try to get her to understand the importance of it, and that it is just to see if there's anything, you know, that maybe they need to change her medication, or maybe she needs to get into therapy, or, you know, something to help her, and then she'll be better able to help her daughter. So I think initially that will be a barrier, but we'll work around that.
Okay.
And then in the implementation, the only barrier I would see that may happen is the agency that I contact may say, as the other agency did, yes, her behaviors are a little extreme and we're not equipped to deal with that.
Okay.
So I may have to move to a different agency.
Okay.
So.
All right. I can't think of anything else, but you might be able to. Do you think we've covered everything that's significant in the case so far? I mean, we've really walked through the practice wheel on this one, so I think that. But if you can think of anything else that you think is significant or we need to discuss, then we'll do that.
No, I think we covered pretty much everything in regards to the family and what their needs are.
Okay. Well, let's very quickly look at the next steps here. You know, we talked about several things, and one of which was ensuring that the new agency coming into the family understands the issue of change, you know, and how that affects the child, and probably how it also affects the parents too.
Right.
So that would be one action step, I guess, that we would take.
Okay.
Is that correct? Then I think that we talked about sort of the lack of family support at this point in time. How do you think I mean, you've got somebody else to talk to, but first let me say, do you think we need to increase that sort of that broad,
informal support? Yes, I think we could work on increasing that, and just by, I can get with the family and see, do they attend church?
Okay.
Or any type of spiritual base, and maybe we could find some supports there.
All right. Okay. And I think that, I'm not sure, was there anything else we talked about that would be, I mean, obviously getting the agency involved,
Right.
you know, would be sort of the same thing as talking with them about their need to be committed to
Right.
the child. So I guess what do you, they're going to do an assessment themselves on this family?
Yes.
Okay. Do you think that we could get the commitment after they did that assessment? Do you feel like we might be able to get, I don't think they would give it to us before they did
Right.
the family assessment.
Yeah, I would just, like I said, initially explain to them and then ask, do they have, do they feel like they're equipped to deal with
Okay.
that type of, those type of behaviors? And then, yes, they would definitely do an assessment and meet with the family and let us know after that.
All right. I detect some optimism in your tone about this family. Do you feel pretty good about where we are and where we're going with it?
Oh yes, I feel like we've been able to help them and get them kind of what you said. They were feeling abandoned and like there were no services, there was no help for their child. So I think now we've given them a little light at the end of the tunnel where there are services and there are people out to help you, not just, because people always, have a bad impression of the department. So I think we've allowed them to see that we are there to empower families to do better.
Okay. All right. I don't see any other barriers to the implementation of your plan, so good work. I mean, I think you've got a lot of things in place quickly. So that's all I have.
Okay, thank you.
Thank you.